Hi everyone, my name is Dr. Patricia Harkins from Dublin, Ireland, and I'm reporting on behalf of Room Now from ACR22. Today I'm going to be discussing abstract number 0477 entitled Can Beta Blockers Prevent Aortic Dilatation in Patients with Giant Cell Arteritis and Large Vessel Vasculitis? This will be presented by Duboisson and colleagues on Saturday's poster session at ACR22. When we are in clinic and we have a new patient diagnosed with GCA with large vessel vasculitis, one of the things that we warn patients about, and indeed one of the things that we as their treating physician are most concerned about, is the development of aortic dilatation, aneurysm formation, and ultimately rupture. While significant strides have been made in the identification of large vessel manifestations of giant cell arteritis, much still remains unknown, including how to best attenuate the development of aortic complications. This is why abstract number 0477 by Duboisson and colleagues really caught my attention. They performed a retrospective study of 65 consecutive patients with newly diagnosed GCA with large vessel manifestations. 15 of these patients, so 23%, were on beta blocker therapy prior to study commencement, and they remained on beta blockers for the duration of the study. This left an additional 50 patients that were not on beta blocker therapy prior to the study, and indeed remained off beta blocker therapy throughout the duration of the study. The study investigators attributed a vascular risk score to each of the participants based on cardiovascular risk factors and/or cardiovascular events. The investigators then analysed patients' first scan and their last scan and assessed for any evidence of new aortic dilatation. What they found was that 15 patients, so 23% of patients, had evidence of new aortic dilatation between their first and last scan. What was most interesting about these patients is that none of these patients were on beta blocker therapy. Or to put it another way, all patients who were on beta blocker therapy in the study did not develop any new aortic dilatation. It's also worth noting that the vascular scores of those who did develop aortic dilatation were not higher than those who didn't develop aortic dilatation. So this is the first study to provide support for the use of beta blockers in addition to conventional management to prevent aortic dilatation in those with newly diagnosed GCA with large vessel vasculitis. Although the study is small and retrospective, in my opinion, it does provide good food for thought for the routine use of beta blockers in this patient cohort. I really look forward to future larger prospective studies that assess this. So thank you all to everyone who listened today. I'd like to encourage you all to subscribe to Room Now and follow us all on Twitter to keep up to date with all things ACR 2022. Thank you.